administering the birth control, pregnancy and disease education. Would also treat pregnancy to childbirth in women, infertility issues, and elder care with osteoporosis testing and care. Also, these are some other services that we provide, common womanly issues that women have. Would explain our next slide, our staffing that we have. So some important things: patients with fibromyalgia, thyroid issues, endometriosis, helping patients manage their menopause, cervical cancer screening, breast cancers, weight management, health and mental health and stress in women, and then parent and child care education. It would work hand in hand with our diabetes clinic, which we'll be talking about. That would help women with gestational diabetes with the counseling and medication. Our women's clinic would have 10 OBGYNs, 10 nurse practitioners, 20 medical assistants, 5 lab or ultrasound techs, and lab and phlebotomists. We would have 5 parent and child educators, 2 psychologists, and 5 licensed social workers. They would all work as a team to treat in the women's health clinic. Each doctor would have a nurse practitioner and medical assistants as a part of their team, and then using the ultrasound technicians in the lab, phlebotomists, so that the patients can keep their care all in the women's health clinic during their pregnancies and different issues that they're having. And then the previous slide, we were treating patients with like fibromyalgia, a lot of medical conditions which could use the help of the psychologists and clinical social workers to help them manage the stress and of their illnesses and diseases. And Diana.
Our diabetes clinic is going to provide multiple tests. The 2 main tests which will identify patients with diabetes: the fast plasma glucose test. This is recommended by the American Diabetes because it's faster, easier, and less expensive, but it's not performed on pregnant women. The oral glucose tolerance test, which is performed on pregnant women. Notice that the actual results of these tests are different in nature. First, you have your pre-diabetes test for your fasting plasma, which is 100 to 125. That relates into you having a type 2 diabetes. It's controlled. It's controlled by diet. It's controlled by exercise. Providing these types of, counseling, nutritional services in this diabetic clinic will allow us to be able to control it more, so it doesn't go to that next step. Once you get to that next step, 126 and greater, or 200 and greater, you're then going to have insulin dependent. Being able to learn how to provide those services, take care of yourself. But it's also important to be able to go through that nutritional counseling as well, because you can control it once you get it under control and have the levels that you need. We'll also have group counseling for our diabetes patients. Sometimes it's nice to always talk to somebody that is going through it. How do you handle your stress? How do you go through this? The support of other people is the best way of treatment. We'll have counselors that will help medication management. It's also going to work closely with the Women's Health Clinic for gestational diabetes. One of the things, being pregnant, you get gestational diabetes, and you have to be able to control that by diet and all those types of scenarios. But having it work hand in hand with the woman's health allows them to get the results that they need and the treatment that the patients need to be able to provide the services that they can get. The statistics. It's scary to think that approximately 70,000 people in Delaware today have diabetes. Why have the diabetic clinic? This is why. 20 million people across America have it. 14 million are aware of the results. When you think about 6.2 are unaware of it. That's why we chose to have a 24-hour doctor's office that not only provides a physician's office, but it also allows you to go and get the lab services. Get the treatment if you have it, get it under control. The early prevention is the leading way of treating this. Here are some other statistics that I wanted to put on here. I looked up Christiana's Care website and noticing their admission rate, their ER rate, their birth rate, and radiology procedures. It's kind of hard to think about your ER visits, 165,000. How many of them were at night? How many were just on the weekend? We could have them come to their doctor. I would feel comfortable going to my doctor than going to an emergency room because my doctor knows me. So how many of those could have been prevented and we saved the cost for the insurance company? We all know going to the emergency room, they don't know what your previous history is. Your doctor does. Tests are going to have to be done. Services, you have to go through the whole thing. The birth rate, 6,520. Providing services, for those pregnant women, making sure they go through their treatments and seeing them through the final stages of when they deliver. Having a radiology, again, 317,000 patients seen in a radiology. How many were actually from a doctor's office going to the hospital to get these services done because their doctor's office didn't offer it? Why not offer it? Why not have it there at your convenience? Our financial overlook. Physician ranging pricing from a sick visit of $60 to $175 for routine services. If we took 429,240 visits, sick visits, it would be a $25,754,400. That's a lot. But imagine how much you're saving the insurance company when you look at those numbers, because you're actually providing the services. Physicals, you're providing physicals every second of the day, every minute, every hour, every half an hour. 53,000 patients seen for a physical gives you 9 million. How many of those physicals, if they're getting the right diabetic treatment, they're getting the right CBC, they're getting their lipid, which will test their cholesterol, getting the early treatment for the physicals and being able to provide the services. The patients, the total would be anywhere from, 35 million to, 44 million if you equal them both together. Patients seeing that, the revenue for the sick visit for a pediatrician. You would have 143,000 patients. It could go 8,584,000. Again, how much are you saving the insurance company by having? I don't know about anybody here. I know that my child gets sick in the middle of the night. If I want to go to the doctor in the middle of the night, I want to see my doctor. I want to know my doctor can see me. That right there saves the insurance company money. Physicals. It's okay. It's okay. Again, providing physicals from child to babies to adults. Everybody needs a physical. Monitoring that the child is actually getting treatment, growing, meeting their standards, and making sure that they're going to develop, and catching anything that's not going to develop. Here's the overall overlook with adding everything together. It's a lot of visits, but again, it's a lot of visits that can be worked on, can be, patients are being seen, the services are capable of being there. Any financial fund would be utilized to provide salary to staff, building upkeep, outsourcing, outstanding equipment, and any other miscellaneous expenses. We've created a pilot program. One of the pilot program that we've decided to go is a child elderly disabled care facility. It is a daycare center that's within 2 of our facilities to provide that extra help when you're a single mom or you're a person that's taking care of an elderly mother or father. You neglect to take care of yourself, so we're helping you to be able to take care of you. It's open from 7 a.m. to 9 p.m. Monday through Sunday, anywhere from ages 6 weeks to 13. We'll coordinate care with your schedules, with your on-site physician, making sure that we take care of your child as well as them. The fees can be incorporated into your office visit. Provide nap times for children during certain times. Parents are responsible to supply breakfast, lunch, and dinner. We'll provide any age-appropriate snacks that are there. Health history. If the child is part of our organization, that will be already accessible to us. Because, again, your medical records, your EMR, that's right there in your hand. One stop, one chart. Our staffing will consist of, you have 1 main unit manager, 10 care providers, and 10 part-time students for area vocational technical high school. Biggest things to use is your resources. Kids are going to school these days. They have those vacational schools. Why not take advantage of the opportunities that they need to learn? We can teach them. Our insurance coverage will consist of approximately 25% Medicare, Medicare HMO, and HMO 18%, 16% for PPO and indemnity, Medicaid 18%. We will have Medicaid HMO, workers' compensation, auto, and uninsured. Uninsured will consist of the Medicare rate. Patients, if they're uninsured, they get uninsured because either they lost their job or they don't have the health care insurance. Providing them a discount rate, which would be what Medicare government provides, when you're getting paid for a Medicare patient, provide that to the uninsured as well, giving them an extra hand in making sure they're coming and getting their services.
Very good.